Good afternoon, everyone. Mark Poloncarz, Erie
Good
County.
afternoon.
Hi, Matt Spina.
Hi, Mark. How are you?
I'm good. We are going to do our presentation. We will mute the reporters' lines, and then we'll open it up at multiple times so that we can get people in and out. Once again, this is our daily briefing for March 19th, 2020, as is often the case. Just to remind everybody that the information is as current as was at the time that it was put on the PowerPoint and the information we've provided. It may change, and often does change, while we're actually in the middle of one of these press conferences. So I want to thank everyone for participating in this press briefing again. And to the general public watching on Facebook Live, thank you as well for watching. We've been receiving a lot of questions through our Facebook Live. We are not going to be able to answer those questions during the press briefing. This is primarily a briefing for the local media. We've limited the number of people that we can have in the room so that we can try to social distance ourselves. I'll be controlling the PowerPoint presentation for all and everyone today, and also be up here for the questions because we had some people complaining about myself and Dr. Burstein yesterday, touching the same keyboard, the same mouse. Dr. Burstein and I, as well as our staffs, have been in exceptionally close contact for the past week. People are worried that we're not practicing good, safe social distancing. That is, I understand the point of view, but we also have to understand that the two of us, as well as our senior staff and others, have been very close contact, constantly going back and forth between offices and so forth. So we want people to practice safe social distancing. We're doing the best that we can as well in the situation that we're in.
Pass the Purell.
Pass the Purell?
Yeah.
Okay, pass. You want it right now?
No,
okay.
just before I leave.
All right. You'll also be hearing from our Commissioner of Department of Homeland Security and Emergency Services, Dan Neverth, as well as a discussion with regards to mental health issues, and we have the CEO of Crisis Services, Jessica Pirro, who will be joining us in a little bit. And I'll turn it over to talk right now to Doc, and I will be controlling the PowerPoint presentation. So, Dr. Burstein.
Thank you. Good afternoon. So just to get an update on our testing numbers, so on Wednesday, March 18th, there were 7 new cases among Erie County residents that were reported to the health department. That makes a total of 27 COVID-19 cases. So on March 19th, we received a report through the New York State Electronic Clinical Laboratory Reporting System of a new case that was tested by Quest. And then in the morning, we received a new case that was reported by the Public Health Lab of a test that was still running overnight. And then during the day, the Public Health Lab is going to be running additional specimens that they had already been collected. So they're not running new specimens that we're collecting today. We're not collecting today. They're running specimens that they had already collected and are being stored at the Public Health Lab. So that makes a total of 29 cases. So just in terms of the Public Health Lab's testing capability, so in total, 523 Erie County residents had specimens collected by Erie County Department of Health staff, of which 29 were positive, 179 were negative, and there are still 315 that are pending that the Public Health Lab has received those specimens already, and from both from Erie County and then from outside counties, because we are a regional public health lab, and those are going to be tested today and in the next couple days. Next. So just want to alert people of potential exposures. So we were informed through our detailed public health contact investigation that there was somebody who had a positive COVID-19 test that was in the following locations at the following dates and time. So on March 7th at the Shamrock Run in South Buffalo. March 9th on a flight from Spirit Airlines, flight N2500 from Tampa to Buffalo. March 9th, all day at Hamburg High School. March 11th, from noon to 1 at Catalyst Fitness at 1404 French Road in Cheektowaga. March 11th, from 6:15 to 10 p.m., the North Collins Volunteer Fire Department in North Collins. March 12th, from 9 a.m. to 2 p.m., the Hotel Henry Wellness Event in Buffalo. March 12th, from 7:30 to 8 p.m., the Walmart on Southwestern Boulevard in Hamburg. March 12th, from 8 to 8:30 p.m., the Lowe's on Southwestern Boulevard in Hamburg.
And I will just note that these slides are on our Twitter page for our friends in the media and otherwise who are immediately or trying to scribble those locations down, so you'll be able to find these slides on my Twitter page at Mark Poloncarz.
So to continue, March 13th, between 9 and 9:30 a.m., the Aldi on Sheridan Drive in Tonawanda. March 14th, the Premier Liquor at 3900 Maple in Amherst. The reporter did not give us, the case did not give us a time. March 14th, between 2:45 to 3:15, the Tops Supermarket at 5274 Main Street in Amherst. March 16th, between 12:40 to 1 p.m., the Tops Market at 2351 Maple Road in Amherst. So remember, if you were at any of these locations, please monitor your health condition. Please, check your temperature twice daily for fever, and then just check in that you don't have a cough or shortness of breath. Remember, you do not need to call our information line. So we have information about where some of the positive cases were during the time where they may have been contagious. However, we have to assume that there were people walking around with COVID-19 that have been in other places in our community that we're just not aware of because they haven't been tested yet. So please do not need to check to call our phone bank. Just monitor yourselves. So now giving the latest update on the number of people in isolation who either have a positive COVID-19 test or are feeling ill, and those who are in quarantine who are otherwise well and had a high-risk exposure. So as of March 18th, 2020, there were 29 people in isolation, and there were 223 contacts who are in quarantine. Next. So, again, we are, really want to pay close attention to monitoring people who could become a very high risk, if then very sick if they were infected with COVID-19. And again, that's our family, close family contacts, any type of close contacts, because again, those are very high risk exposures, very likely to get infected. Also, the elderly, people who have chronic conditions, those individuals are very likely to become very ill. And then healthcare providers and anybody in a medical facility, because again, they're the backbones of our healthcare workforce. We really need to make sure that they're identified and the appropriate actions are taken to make sure they can get to work in time and that other people are not exposed. So remember, also, if you have elderly, like parents or grandparents at home, please be careful. Please do their errands for them. Please help them stay at home and stay healthy. So just in terms of the self-monitoring, we're really calling on Erie County residents to implement their own self-monitoring. With, again, we just have to assume that you've probably been somewhere where somebody was infected with COVID-19 because it's prevalent in the community. So I think we all have to assume that we've all been exposed in some way or form. So again, when we know where a case has been that was symptomatic and possibly able to transmit in the public, we will let you know. But again, just because we didn't list a place where you weren't, doesn't mean that you weren't infected. So I think we just all have to assume that if we go out in the community, we can be exposed. That's why it's really important that our seniors and people with chronic health conditions try to stay inside as much as they can. Okay, next. So we just want to, again, reiterate where you can get some good, credible information. So we have our Erie County helpline at 858-2929. And remember, we have a very high call volume, especially after one of these press conferences. We receive like a huge bolus of calls. So you're going to have to expect to wait for a while. And then please, we're trying to give factual information around true circumstances that people have. So please do not call to ask about hypothetical circumstances. Also, just want to reinforce, we have great information online on our Erie County COVID-19 website, and also the the New York State Health Department and the Centers for Disease Control and Prevention also have some great information around COVID-19 on their COVID-19 websites. So now I can take some questions, and then I have to exit for an important conference call I have to participate in.
So we will go in reverse order from yesterday. So we will be starting, is there anybody from the B newspapers or Western New York media on? Is WBEN on? WBFO? We appear to have 3 reporters from the Buffalo News, Matt Spina, Sandy Tan, and Maki Becker. So to the Buffalo News, I'll let you guys decide who's going first.
Do you mind if I ask a quick question? Oh, go ahead, Maki. Okay. One of the things we've run into is that we're getting reports from like Kaleida or Roswell Park about them confirming a case, and we want to make sure that those are the ones that are already being announced by you guys. Is that correct?
Well, what we are announcing are potential public exposures where people, could have been exposed and are at risk of, potentially becoming infected. These cases in the healthcare facilities, we've done thorough investigations on them, and those individuals were either in isolation or else in, negative pressure rooms, or else there was, the appropriate personal protective equipment done by the healthcare providers that may have been infected, and so there is no potential exposure to the public in those particular cases.
But Maki, I think your question is, are those in the 29 cases? I think that was the question. Yes.
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 Yes. So of if there was a case at Roswell, a case at another hospital, it has been a positive identification. It is included in our 29 positives. What we are identifying, as the doctor noted, are those that were out in the public, and there's a potential risk for community spread.
Right, but we are giving you all the data that we have, all the numbers that we have.
Sandy?
Yes. I mean, just to follow up on Maki's question, obviously individual organizations like Tops or, some other business might announce that, hey, we have a confirmed case. We just want to know, is that being counted? And in fact, can you confirm somehow when you give us those lists if that's counting what is already being separately publicized?
The data that we're giving you, the numbers that we're giving you are our totals. So, again, each individual organization has the right to announce their own individual cases. We're giving you the aggregate total, the total number of cases.
So those would not be in addition to our number. Those would be included in our number.
Okay. Thanks. And then just from the county executive, obviously it's concerning to a lot of people that the county no longer has the ability to do widespread community testing and to see how much of a community spread we have. I recognize that the feeling is that everyone should just believe that COVID-19 is all around us and we should be careful, but I didn't know if there's any particular concern on your part that we simply just don't have the ability to loosen the restrictions and do more testing, which was, my understanding, the county's original goal.
We can't do more testing if we don't have either the swabs or the reagents. We were able, and I was able to procure through New York State, once again, about another 200 swabs, and now we're down on reagents. I get very disappointed every time I hear someone on the national level saying there's testing capability for everyone, because we know that's not true. We are doing our best to get tests, but it's not an issue of purchasing power. I know the comptroller issued a report saying that we should be able to buy them. We can't buy them. We're getting them actually from free right now through New York State, but it's not an issue of purchasing power. The legislature just approved $5 million in emergency funding. We have the money to purchase them. We just can't get them. They're not available. And we're not the only ones. This is a national issue. I'm talking to my colleagues across the country, and they're dealing with the same thing. There's a limited stockpile of them. We've tried to get them from outside third-party sources, and we can't because they're not transferring them except to the CDC. We're working the phones. I'm doing everything I can to get more. But right now, when it comes to the tests in New York State, it's New York State that's controlling where the swabs and reagents go. And I don't blame them because they've got tests that want to be run all across New York State. The same thing as Dr. Burstein said. Even if you did not go to one of the locations that we identified, you probably went somewhere else where someone has it. We are going under the assumption that there are many, many people in Erie County who already have it, who may not know it, who think they have a common cold, or believe that they might not even be suffering from symptoms, because some people who have COVID-19 do not show symptoms. So we're just reminding everyone, while we have limited testing capability, we will be able to finish the tests that we committed and the swabs that have been taken. But until such time as we acquire more swabs and reagents, especially reagents, there's not a lot that we can do with regards to testing. We just want people to understand it's out there, so please heed the advice with regards to work rules, with regards to social distancing. It's out there, and you have to assume someplace you went in the public, someone went there themselves and has it, and that's just what we have to deal with. Matt, do you have a question before we go on?
I do. Thank you, Mark. I've talked to a couple of patients who've tested positive who tell me that on Sunday, this past Sunday, they were called and initially told that they had tested negative, and then got a call back from the Department of Health soon after telling them that their results were indeed positive. And I was hoping you could speak to that, what was going on there, and if whatever was causing that glitch has been remedied, and how.
The first I heard of it was your report. I had not heard of that. The doc may have more information on that.
There was just a misread. I mean, that when we have all the correct data, and we caught that very quickly, and called the patient back and gave them their the correct test result. That was just an error in reading the result. So I mean, and that was by the the epidemiologist had a line list, and then read the wrong line. So that's happened once. You wouldn't believe how busy it is in epidemiology, and they're really scurrying to get these test results out, to do the investigations. And we feel really terrible that there was an incorrect result given to one individual, and that has not happened again. And we've taken actions to make sure that system did not come back.
Doctor, we have two people who've told us that has happened. Do you feel as though there are more? I guess I'm just kind of trying to get a sense of the volume.
I'm only aware of one, and then there is a system in place so that it's not going to happen again.
Okay, thank you.
Steve Brown from Channel 2 or other Channel 2 reporter.
Good afternoon. I have questions about healthcare workers that are either seeking testing or have been tested. Given the current state of your supply, are these folks going to be given some priority given the importance of them being able to stay on the job? Because I know of at least 5 that are marooned at home right now, either because they're waiting for a test or waiting for test results.
Well, the New York State Department of Health recently issued new guidelines for isolation, quarantine, and return to work for healthcare workers. So we are following those guidelines. So it's not as stringent as because we want to get those individuals like back in the workforce. So there's instead there's more intense monitoring when they do return to work sooner than we would allow the rest of the public. So again, we're filing guidelines from the New York State Health Department, and those individuals no longer have to be in isolation or quarantine for 14 days. So again, they will probably be able to return to work in the next few days, depending on their symptoms. And again, it's a case-by-case basis.
And if they were swabbed, they will be tested, but there is a limited amount of tests that can be done on a daily basis. So some swabs that may have been taken yesterday still might take a couple more days to go through. So if they were swabbed, they will get results. If they have not been swabbed at this point, there's really not a lot we can do because we don't even have the capability to test.
Well, they can send to Quest or LabTorque, a commercial lab.
Correct.
And then also in this New York State guideline, they do give an option for an algorithm, pathway that we can follow where testing is not available, because we're not the only county in the United States where testing may be limited. So they do have a protocol that we can follow where tests are not available, and it's a combination of duration of symptoms when they resolve, and then close monitoring. So we are also following those guidelines. So a repeat test or a test may not necessarily have to be performed at this point with these new guidelines.
So please help me understand, in one particular case, there is a woman who works as a geriatric care advisor. She's in and out. Prior to being sick, she was in and out of facilities that specialize in elder care. She's been symptomatic for over a week. She still has some symptoms. So based on the guidelines that you're describing, should she stay at home until she's no longer symptomatic? Should she insist on a test? If she's going to get a test, how much longer does she have to wait to get that test?
Again, I can't discuss specific cases. What we could do is send you the guidelines. I can give them to Kara, and you can see what the guidelines are that we're following.
If she has not been swabbed yet, I recommend she call the White House, which keeps on telling people that everyone's going to be tested, because they're the ones that are supposedly sending supplies out. They don't have them.
And again, she can work with her primary care provider or her health care facility to get the swab and the test performed by one of the commercial laboratories that has that available.
Now we're going to move on to WIVB Channel 4, Erica Brecker.
Hi, yes, thank you for taking our questions. Mark, I think this one's going to be more directed at you based on your focus, kind of a two-parter. Can you explain why reagents are more limited than swabs and what their importance is to testing? And if there's any further explanation you can explain as to why the testing is so limited in Erie County. I understand it's not the purchasing power. What is the distribution process that is preventing Erie County from getting them?
I'll do the second part, and I'll turn the reagent swab over to the doctor. First off, I want people to understand, up until a few weeks ago, there was no test in the United States at all. The original batch run of tests that came from the CDC had defects in them. So the original test, which we don't have, and we didn't have because we weren't talking about coronavirus a year ago or 6 months ago. It wasn't until the last few months that you started hearing about it from China. And there was no coronavirus test. We are under the assumption and do know that the White House turned down the World Health Organization's offer to provide test kits to the United States so that we could become preparing. Why they did that, you'll have to ask that question to the President and the members of the White House staff, because if they had offered it to the Erie County Department of Health, we would have said, we'll take it as long as we have the work in the product that allows us to do the tests. So we were like every other public health lab in the United States, working behind the eight ball because we were relying on the federal government and the CDC to provide us this information. They didn't. And so we don't have the capability to make reagents. It's not something that we can do here. We have to rely on the distribution of it from exterior sources, third-party sources. And in this situation, it's either the CDC or, as we've been able to do lately, acquire it from New York State. We have tried to reach out to the third-party manufacturers that allegedly exist, and they've told us they cannot ship to us because everything has to go to the CDC. This is not like Erie County is dropping the ball. No one is handing the ball to us. They're not even giving us the ball. And so at this point, there's limitations on what we can do. And I'll turn it back to the doctor to talk about the difference between reagents and the like.
So the thanks. So the viral nasal pharyngeal swabs that we put in the viral medium that makes up the specimen collection kit. So those are in shortage, and so that is to collect the specimen that we will then test. The reagents are the chemicals that we need to perform the test. So they are both in a national shortage. Sometimes we're fortunate enough to be able to secure some viral nasopharyngeal testing kits. Sometimes we're able to secure some testing reagents. It's just luck, whether and I think skill of negotiation of whether we're able to get the testing kits or whether we're able to get the reagent. They are both in a shortage nationally of supply, and so it's just whatever we were able to get.
I've burned out
Are
my...
these not the same thing?
No. The specimen collection kits are they look like little Q-tips, and so for the swabs, and it looks like a Q-tip swab, and so that's what we use to collect the specimen and then store it until we are going to test the specimen. So nasal pharyngeal just means back deep down in your nose and your nostril. So we're collecting some cells and whatever mucus is in there and putting it on the swab, and then and it's being preserved in the fluid in the medium in a test tube, and that's being sent over to the public health lab, and then to perform the test, you need specific chemicals to perform the test. So the reagents are the specific chemicals that we need to perform the test. So one is to get the specimen to test, and the other is to actually perform the test.
And just because I'm sure people are thinking, I asked the question, not being the medical personnel, if we were out of swabs, could we use Q-tips? And the answer is no. They have to be specially designed. They have a compound in them for the collection. So we can't just go out there and buy a whole bunch of Q-tips to do the swab collection. Madison Carter, Channel 7.
Yes. Quick question at the top. You announced that there were 2 cases today. We have one in Amherst. Do you have a location of the second one?
No. We'll get that out when we're well. Our epidemiologists are aware. We were advised of it just before I was changing the PowerPoint presentation with Health Department about 10 minutes before the presentation. So once we have that, we'll announce it.
All right, thanks. And then my second thing is, I think for our viewers, it's a scary headline that we don't have tests anymore, but obviously the tests it's not curing people, we're just having the positives. So can you help me explain the effect of not being able to test more people or maybe track this? Like, what are we going to see happen in the long term?
Well, just my own view, and I'll turn it over to the doctor who then has to go. We were worried at first about community spread. Well, actually, backtrack. We were worried about having a case. We kind of figured we'd have a case, and for a while there we were testing and they were coming up negative, and then we had our first case and our second case. Now we have 29, and there are cases of community spread in those cases. We are going under the assumption it's everywhere. Just because your town is not listed does not mean there's someone in your town who doesn't have it. There probably is someone in your town who does have it. So we want the public to understand that even if we are unable to test for a day, 2, or moreover, till we get the actual equipment to do it, that doesn't mean that there aren't people out there in your community who don't have it. They probably already exist. I'm going under the assumption that there are individuals who reside in every town, in every city, in every village in Erie County who presently have COVID-19. They may not even have a symptom. We've seen the cases from across the world where there are some young individuals now that are on ventilators in Italy, and I saw reports from Dallas County of young individuals in critical condition. When I'm saying young, I'm not talking about 5 or 6, I'm talking about 25, 36. So it's everywhere, and it can have a negative, very bad, including deadly effect on individuals that are even young and in good shape. So that's why we're stressing you need to follow the rules with regards to reduction of workforce as well as the social distancing. Doctor?
Yeah, our county executive is spot on. I mean, we do have the information now that there is community spread, and I think we have to act accordingly. The downside is that it will be more difficult to follow local trends. However, the commercial labs are still testing, and we'll have those data through the New York State Electronic Clinical Laboratory Reporting System, our surveillance system. And then also we'll be able to see state data and then national data and follow those trends. So we're not, I just want to tell people we're not completely powerless to know numbers. I think the important thing is, knowing when we're at our peak and knowing when we're coming down, and that's information that we can use to guide our behavior. But again, right now, no matter what the numbers are, we know that we're still going up, and then we just have to, take our non-pharmaceutical intervention precautions with hand washing. So I'm going to put on some Purell right now. Social distancing, so I'm going to leave you right now.
Okay.
And staying away from people that are sick, and if you are sick, staying away from other people. Luckily, we're not in those categories yet.
Let's hope we don't. With that, I want to thank the doctor. If other members of the media have questions, you can email those to our staff, and they will get you answers to them, and we'll try to answer the latest town from the most recent documented case and get you more biographical information on that as well. I'm going to go through a few things, and then we're going to have our the Commissioner of Emergency Services and Homeland Security, Daniel Neverth, speak a little, and then we'll have Jessica Pirro. A lot of people are asking questions. Oops. A lot of people are asking questions about child care. And we want folks to understand that we are in the process of putting together a mass response for public health as well as first responders and, of course, the individuals who are working in hospitals and other types of healthcare facilities. We encourage any first responder, healthcare worker, or municipal employee in need of immediate child care to contact the Child Care Resource Network at 877-6666. Once again, that's the Child Care Resource Network at 877-6666, or you can email at parentservices@wnychildren.org. Once again, that's parentservices@wnychildren.org. They are working with our Deputy County Executive, Maria White, and our Commissioner of Social Services, Marie Cannon, who you can't see, but they're sitting here, and they are literally putting together one of the largest child care networks in a very short period of time to address the need that exists out there. We are also recommending, once again, that the public can help us by not sending your children to child care if you are working at home. We've had some people say, well, I can't work at home unless my child's gone because of my job. Well, the problem is we really, really need that child care for individuals that work in hospitals, in the public health field, and government. I do know that since the schools have closed, and we were worried about this, that I've heard from the various hospital networks that hundreds of employees have had to call off due to the fact that they have no child care and they have to take care of their children. And we want those healthcare employees going to work. So if you are at home, please do not put your kids in child care. Have them around the house. You can do your work around the house, but we need those child care spots for our individuals that work in healthcare organizations, hospitals, other public health, emergency services, and government. So please keep that in mind as we go through the upcoming period. A very important development that was announced just recently by Mark Sullivan, the CEO of Catholic Health, is that Catholic Health has announced that St. Joseph's Hospital in Cheektowaga is being converted to a COVID-19 only facility. I want to thank Mark Sullivan and his team at Catholic. We've worked very well with Catholic Health through the years. They are the provider of the primary care at our Erie County Health Mall. We've been working, myself and Dr. Burstein, with Mark and the New York State Department of Health, including Dr. Zucker, to make this a reality. They caught on a dime, they got this done, and in a very short period of time, there will be a dedicated hospital for COVID-19 patients in our community. What we're trying to do is to keep the COVID-19 patients that may be in hospitals out of the general population and put them into a hospital where it's solely COVID-19. We know we're going to need more hospital beds, and that's why I am very, very happy and pleased that Catholic Health was able to announce it and that we're able to reaffirm the decision and has the full support of Erie County. I spoke to Cheektowaga Supervisor Diane Benchikowski about this earlier. She understands the need for this, and she understands that St. Joe's is a great place to have this hospital. And I really thank, once again, Catholic Health and its CEO, Mark Sullivan, and their entire team, Marty Borzak and the rest, for really doing this very quickly so that our community could very soon have a dedicated COVID-19 hospital. Guidance for business. Of course, the governor has ordered that all businesses, except those that are essential, which I'll talk about in a moment, have to go down to 75% of their workforce in their work location. If they can work at home, they can work at home. They do not. You don't have to lay them off if you can afford to provide them work and they're still working for you. You don't have to lay them off, but you can only have 25% of the individuals you normally would have had on the work site. And I just was about to say construction because it applies to everything, is what I've been told, except for the following businesses. It does not apply, of course, to hospitals, healthcare providers, mass transit, law enforcement, nursing homes, retail establishments, and grocery stores. The local governments are under the 50% threshold still, but for all private businesses, and once again, I saw great action and reaction from General Motors and Ford. They shut down, which is very helpful. But no matter what you are, if you're the local nail salon, you got to cut down to 25% occupancy. If you're the barber shop, you got to cut down to 25% occupancy. We're still trying to keep open needed services for our greater community, but we have to find a way to reduce the community spread, which we know is out there. This is being applied across New York State. If you are seeking a waiver, and there is a method to seek a waiver, you have to go through Empire State Development. I recommend you go to Empire State Development's website. So just type in Empire State Development into your web browser, and it'll take you to their website, and the information, including how to apply for a waiver, is on that website. With that, I'm going to turn it over to our commissioner. Officially, I always mess this up. I say Emergency Services Homeland Security, but it really is the Department of Homeland Security and Emergency Services, otherwise known internally as DISHES, Dan Nevra.
And you don't have to call me doctor.
Yes.
So we don't have to worry about that. Actually, the reason why I wanted to sit in today is just going to give a little bit of a situational update from different things that I'm hearing, different rumors, a lot of things that are going on out there. And I thought really from a situational standpoint, it would just be a good idea just to give you an idea of some of the things that we're working on. Because as I'm sure you can imagine, in addition to the Health Operations Center that's going on, there is a whole world of things that are actually happening out there. So I just want everybody to know when we talk about an operation like this, we're talking about managing and management by objectives. And the reason that I want to bring that up specifically is because I want you to know that as part of the management of objectives, the number one objective, whether it happens to be this current operation that we're going through, firefighters out on a fire scene, law enforcement doing some type of action, the number one priority always is the first responders. So I want you to know that we are, in fact, focusing very, very closely on all of the people that are a part of our operation and other operations. As a matter of fact, if I could just read for you, our number one priority from our incident action plan is maintain health and safety mitigation strategy for incident personnel. So There's been a number of different things out there from a number of different sources, a number of people that have expressed concern that maybe that's not something we are focused on. We are always focused on that, whether it happens to be a weather-related event or it happens to be something like what we're going through at this present time. The county executive did mention in his earlier press conferences that we are in uncharted territory. Well, a little bit of a pep talk here from some of the things that I'm seeing going on outside of our operation as well is the fact that it might be uncharted, but that really doesn't mean impossible. And just to give you an idea of some of the things that 2 weeks ago I would have had looks as if I was crazy, and other people would have had them shot down immediately. Our dispatch centers countywide with regards to the Buffalo Police Department, with the Sheriff's Office, with our medical emergency radio system, has actually now branched out, and they're actually separating dispatchers so that they're dispatching from separate individual locations. As I go around and take a look at some of these different operations, restaurants and things, we're seeing throughout the county and hopefully throughout the nation, people reinventing themselves and different things that are going on. So anything that our operation can do to help that, or county government can do to help that, as far as businesses or maybe some things, some mountains that might need to be moved, those are the type of things that are part of this process, and you're seeing some of them even with child care and some of the other major issues that we're facing as a result of this unprecedented issue that we're facing here. So I just wanted everybody to know, a quick little side note here, we do have a weather event that's coming in, but because we have broad shoulders here in Western New York and we can deal with these things, we can take on multiple things at the same time. So there's a broad focus with regards to a lot of the things that we have to deal with. We are dealing with them, but first and foremost, we are dealing with them in a very, very safe manner. So I want you to at least understand that part of it. Quick little example of some of the misinformation that's out there and maybe some of the education that needs to take place. N95 masks. We hear constantly there's a shortage of N95 masks. These are the type of resources that there is a specific need for N95 masks. There are individuals that have been fit tested and are qualified to wear those N95 masks. They're not something that you just take and anybody can wear them. And the reason why we have fit testing is because we want to make sure if we're putting you into a hazardous environment that you are in fact wearing the proper size mask from the proper manufacturer. It's that complicated. We're working through that. We're having stations set up all over so that non-traditional first responders as well as law enforcement agencies now are fit testing their personnel. But if I give you a piece of protective equipment that in fact is not protecting you the way it's designed, we're setting you up to fail, then that in itself is poor leadership. We're not going to allow that to happen. So again, our number one priority. And if I could just leave you with this morning I was out at one of those institutions, one of those places that was reinventing itself. It was a restaurant that was dealing strictly in takeout. As I was approaching it, there were three gentlemen. I heard this cry literally from the roof. I looked up and there were three guys that were working on the roof of this facility, and they were putting a new roof into place, and they were like, keep up the good work. Keep up all of the hard work that you're doing. There are a lot of people that are involved in this, and I can tell you what, you can pay people, you can have volunteers, but if you know somebody that's actively involved, unfortunately, there's people that have to be the face of this, but if you know people that are actively involved in this operation, or you see random acts of kindness, it goes a long way to re-energize individuals, and text messages and other things too. I would have taken a picture, and I would have posted it on social media. The gentlemen were probably violating a dozen OSHA requirements. So thank you for the encouragement. I will not share that photo with anyone, but those are just the type of things that we're working on. We'll keep an eye on the weather. We got your back. We're communicating with all of our utilities. We are doing that on a regular basis. So we're gonna keep moving through this thing, but just everybody keep a positive outlook on everything.
Thank you, Commissioner. And the Commissioner, the weather event he's talking about, in case you were unaware, is we're expecting a wind event of gusts of potentially up to 60 miles an hour on Friday. So we will be monitoring that. I've already received contact from representatives from National Grid that they are stationing their trucks in the right spot. And I just want to affirm what the Commissioner said. Thank everyone that's involved in this. This is going to be a long, unfortunate situation we have to deal with. But there are incredible individuals that are working all across governments, from the people, and of course, doing the public health aspect of it. You're going to hear from Jessica Pirro on the mental health very soon. But to the sanitation workers in your town, the sewage treatment facility workers that have to go out there and provide these services that are much needed for the public, to the individuals in our buildings and grounds who are going up and cleaning the buildings and spraying the antivirus, no matter who it is. People are sending me texts that I know. They're sending me nice notes on social media. Thank you. It means a lot, but do the same for a lot of the other folks that you know that are working out there, not just in government, but in the public health and other fields, because they're putting in a lot of hours. They're putting in great work, and it makes me proud to be county executive of this community when I see what this community is doing. With that, I'm going to turn it over to Jessica Pirro to talk a little bit about the issues associated with some of the things that we're seeing, especially now in the mental health category.
Well, thank you so much for including us in the conversation today. I'm the CEO of Crisis Services, and as the 24-hour crisis center, we're working very diligently to be present and available for this. So I think what's important as we're looking at all of the needs of our physical health is also to make sure we are paying attention to our mental health. That this is a stressful time for everybody, and we also need to realize that the anxieties we're feeling is very normal. This is for everyone across the board. This is to be expected, and it's expected that we are going to have anxious times as we're dealing with this, and to make sure that we also know that we're not alone. We're all feeling this. We're all in this together,
Yes,
and we're all having the same reactions and thoughts. We're definitely in a marathon and not a sprint. This is a process. One of my staff actually said it really well today, that we have to ride this process, right? It's like riding a wave a bit here, and I think that that's something we all have to kind of embrace at this time. I think it's important that we talk about how we're finding healthy ways to relieve our stress. I think that, things have been offered already. Obviously our county parks are available. Getting out, enjoying the sunshine, enjoying fresh air, that's also going to be very helpful for us at this time while we're trying to kind of manage all that we're managing and the ever-changing experience that we're having here in our community. I do also want to stress just the connectiveness that we need to keep going, reaching out to families and friends and neighbors. I was on with a team today, and they said, we have to be socially distant. This is really important, but we don't need to be emotionally distant. We need to engage with each other. We need to help our friends and family who may not be as tech savvy as we might be to set up ways to make those things connected. So reaching out to family, friends, and neighbors to do that, and really to understand that it's expected to reach out for help right now, to ask for help, and to also really assure that, again, you're not alone, that everybody here is in need of that help and support. So there's some helpful tips that are being shared here as part of the PowerPoint. Sorry, can I shift this a little bit? I'm having a hard time reading today. Again, going out and about. When you're going to get your groceries, it's really important to obviously pay attention to how you're doing that, your social distancing, and also how you arrange that. Having your proper hand sanitizer and things like that is really important, as well as you're managing to make sure that you have your basic necessities with you. Medications, making sure you're informing your healthcare providers on any medications that you need at this time and arranging to pick them up. And also making sure you could have a larger supply if needed, especially for our daily medications, and talking with them. Finances, we definitely encourage everyone to be talking with your employers about why you're missing work maybe, or also connecting with potential vendors, utility providers to request any assistance with payments. With your appointments, connect with your doctors and see if you're able to do a remote appointment. A lot of providers are moving to this. I know from the mental health community and providers in our community, they have quickly this week moved to a telehealth model. So please continue those sessions, those therapy sessions, or other supports that you need, because they'll be able to do those remotely. And also from a social perspective, to stay properly informed about exposure, limiting your exposure, and just reaching out to others in the various platforms that are available to us, being with the technology we do have available to us. So with that, there's the hotlines that are available. Crisis Services is going strong. Our team has done an amazing job through all of this. The 24-hour addiction hotline is 831-7007. Our crisis hotline is 834-3131. And also to know that we still have our emergency mental health crisis mobile teams working in a very safe manner. So we provide that service for anyone over the age of 18. For children, please contact Spectrum Crisis Service, Spectrum Cares Program, and that information will be available on the website.
We have
And
it
the
on the
Erie
next
County
page.
Domestic Violence Helpline is 862-HELP.
There's the CARES.
I got ahead of myself. So, so for your children, obviously, if there's any concerns for your kids as you're home or as they're dealing with the stress of this experience as well, Spectrum has the mobile team for kids, so please call them at 882-4357. And also under Spectrum Health and Human Services, there is an urgent care that's available for mental health, and that number is 539-6743.
That.
Okay.
Thank you, Jessica, and she'll be up here for a few more moments to answer any questions we may have from media. I just want to remind everybody that we have many resources that are available. We have our COVID-19 hotline, 858-2929, but you should only call that if you have a real question regarding your health. You should not be calling with hypotheticals. And there are other resources out there, such as if you're trying to figure out if the trash pickup has been changed or something like that, you need the number to another resource. You can call 211 24 hours a day, 7 days a week. We also have our websites, of course. We've been talking about them, the Erie County website, the State of New York website, the CDC website. Every one of those websites has been updated daily with information as we receive it, so we want people to understand that. We, of course, have an English language page for COVID-19, but we also have a Spanish page for COVID-19 on our county website for Spanish speakers. I'm not a Spanish speaker, so I will not try to even pretend I'm a Spanish speaker. But with that, I'd like to thank everyone for the great work. And I do want to thank Chris and Kate from Deaf Access Services for assisting us today with the American Sign Language interpretation. And now we'll reopen it back up to any media who may have questions of myself or of Jessica. So why don't we start once again with the Buffalo News. The Buffalo News.
Yes, I'm sorry. I'm here.
Sandy? Why don't we?
Monkey, are you there too, or is it just me? I'm still here. Just, oh, okay.
So let's start with Sandra. Sandra
Okay.
first.
So when I was talking with Dr. Burstein earlier today, she had mentioned that the county wasn't quite prepared for this level of escalation of the number of needed tests, and they didn't expect that they would have such a shortage. So I guess I'd like some clarity as far as when the county actually started requesting tests, because I don't have a good sense of that.
It's my understanding that we had to go through the testing validation protocol. We did not receive initial tests from New York State. We received them from the CDC. We also were a little bit surprised on the number of requests of tests that New York State asked us to do for other counties, to the point we had to stop accepting tests from other counties because we did not have enough to continue to do that and truthfully test Erie County residents. If you remember, Sandra, in some of our initial reports, we were reporting that we were doing 30 tests in a batch or in a day, and only 14 or 50 of them were for Erie County. We did underestimate the number of tests that we were going to be asked to do for other counties, and as a result, that has limited our ability to deliver the tests as we thought we would be able to for Erie County. Now, when all is said and done, we've been able to do a little bit better than we probably originally estimated just because of the changes we were allowed to do with reagents and swabs. Originally, they were saying we had to use 2 separate swabs for one person, and then they said, no, we could use one. So we were able to, in the long run, and will be able to test exactly where we thought we'd be, but unfortunately, it's not enough. And in this situation here, I think we could probably test for the next 6 months and continue to come up with positive cases as long as there's community spread. So that's why we keep on reminding everyone that even if we can't test you, there's a chance that you may have it, or you may have at least come in contact with someone who does. Even if you're not showing results, you are, or symptoms, I should say, you actually may have the illness and just not know it. Maki?
Can you hear me?
Yes, I can hear you.
Okay, great, thank you. Jessica, maybe you can help with this. I've been looking into what's been going on within the addiction recovery community. I know there are a lot of concerns about the methadone clinics being very crowded, and I know you addressed that last night, and it sounds like they're going to make some changes there. But even beyond that, I'm hearing about worries about people not having access to group like NA or AA meetings. Things that anxiety, within that community already is a complicated issue. I'm wondering if you could talk about what's being done on that end.
Yeah, absolutely. So I think what's important to know as part of the county's disaster response plan, there is a specific part of that plan that talks about behavioral health response. So the county mental health department, in partnership with the health department and crisis services, as we play that role with them, are continually evaluating with the partner agencies about what they're doing, what they're able to do, how quickly they can get things.
Steve Brown, can I get Kate Meeser, please?
We're going to have to mute you, Steve.
So just so you understand that part of the evaluation process is constant communication with the various behavioral health entities in the county, how they're setting up their processes and procedures around telehealth, ways that they could do technology groups and things like that, so that their clients and those that receive services will see some seamless ways that they can still access that without physically being together. So those things are rolling out, as everything is, as different agencies get their telehealth stuff set up. There's been a lot, too, that we've been waiting to see about things that have been waived federally so that we can manage some of this from the behavioral health lens. But you will see these things quickly being implemented. We do encourage community members, if you're connected with a provider for substance use or mental health, to please contact them so you can determine how to get that set up. That's going to be available to you, and there might be some things that you need to get coordinated on your end as well so that that ongoing support can be there. But it is an evolving situation, no different than everything else, and so please continue to stay tuned to the website because a lot of the stuff is being shared, as well as social media. The different agencies are sharing that out to their consumers.
Thank you. Is Matt Spina still on? If not, Steve Brown, are you still on? You were on. If not, we'll go to...
Yes, I'm here.
All right, Steve.
Sorry.
Do you have any other questions?
Are you there?
Yes. Do you have any other questions?
Are you still there?
We're here, Steve.
Okay. There. I'm sorry. Technical errors and all mine. In regards to the difficulty with doing new tests, if your ability to test is limited and your ability to be able, therefore, to trace backwards where COVID positive people have been in order to try and locally flatten that curve out, flatten that peak out of cases, what's the county's strategy going forward? How do you go about that goal of keeping your healthcare system from being overrun? What's the plan going forward?
I'd like to first off remind you, it's not just the county strategy, it's the statewide strategy. It's to do their best to keep individuals from sharing the illness. It's not just Erie County in Western New York. There's Chautauqua, there's Cattaraugus, Allegheny, Wyoming, Genesee, Orleans, Niagara. They are pretty much all relying on us to do tests. And that's why we've been calling and demanding and pleading to get more tests. At least I have. It's very, very distressing when I have to get back off the phone and say I was only able to acquire 200, and then hear from my counterparts elsewhere, it's like, how did you acquire 200? Because we can't get any. It will make it very difficult. That's why we're saying to everyone, it's everywhere. And
But minus those diagnostics, what's left in the satchel for you to do? I appreciate that the county's lab has greater responsibility than Erie County, but as Erie County executive, what's left in your toolkit to be able to address this issue of testing is limited going forward?
well, then we're relying on what we were doing even before we had the ability to test, which is talking about non-pharmaceutical interventions, the social distancing, the other aspects that have been put in place. The testing only proves that someone actually has COVID-19. It doesn't change the outcome of how we address it. So the testing just gives us positive proof that the individual has COVID-19. Do I expect more tests? Yes, I do expect more tests. I can't give you a day. So as of the tests that we complete today, or the swabs that we complete today, the samples that we receive, we're still going to do the tests on those because we think we can get through the remainder of those, but then we're done until such time as we acquire more testing reagents and additional swabs. Do I expect more in the future? Yes, I certainly do. I just don't know when. We're relying, truthfully, on the federal government at this point to find a way to make more of these and distribute them out to the health labs across the country that need them. I'm fairly confident that, because I know it's the case after talking to my colleagues, whether they're elsewhere in Texas or California or Nebraska, that they're saying the same thing. It's not like we're being treated poorly compared to the rest of the country. Compared to New York State, New York has a tremendous need right now in New York City. You're seeing this tremendous replication of positive tests, which means it's all over portions of New York City. So I wish I could give better answer. I'm very disappointed in the federal response, like many other people. I don't think we'd be in the position we are today if the federal government had acted differently 2-3 months ago, but they didn't. We can't change the past. All we can do is address the future by doing the best that we can to limit the spread in the community, and for those who get sick, to respond to it by doing what Catholic Health did today, turning St. Joe's into a COVID-19 only hospital, and the other things that we're doing, like looking at other sites, including hotels, closed hotels. We've had conversations with Palladino with regards to Old Children's Hospital, Billy Palladino. We've had conversations with Mr. Stimson regarding the Buffalo Grand. And potentially what it would take to get that converted into either a quarantine facility or an ICU. As everyone knows, we're thousands of beds short in New York State, and we don't have enough beds that we potentially are going to need for this crisis over the next few months. So we're looking at all options. There's a lot of people that are working hard. I posted a picture last night around 9:30 or 9:40 when I was leaving, and there were a lot of lights on in the Rath building. And somebody, I don't see many of the responses because I'm too busy, but I saw one response, which is, why are anybody working there if you're not doing testing? We're doing testing, and we're doing so much more. That's why I give a huge round of applause and thank you to every one of the individuals in local government in the public health field. We are preparing for the worst case scenario. I'm hoping we don't have the worst case scenario. I wish the federal government had prepared for the worst case scenario, then we might not be where we are today. But it's too late to change the past. All we can do is prepare for the future, and that's what we're doing now. Erica, are you still on the line from Channel 4?
I am, yes. On the heels of literally what you were just saying and the announcement about St. Joseph, can you update us on where the county is in exploring the old Erie County home and the Lakeshore Health Facility that just recently closed?
The Lakeshore Health Facility is actually in Chautauqua County. Erie County doesn't have the power to activate that. It has to come from Chautauqua County in New York State. I have been in contact with New York State Senator George Borrello, the former county executive, my former colleague until he was just elected in the special election. They are working. We can hear you, whoever you are. I'm going to lower that. It's all right. We are working and to offer support with regards to Lakeshore. Regarding the Erie County home, we have had Rodriguez Construction, which is our at-design construction contractor, come out there, working with a number of subcontractors, including some of the larger, more well-known contractors in the field and the heat, HVAC, and electrical. And right now, they're doing the calculations to determine what it would take to get a portion of the old Erie County home, not the full home, but a portion of it, so that we could at least potentially have 100 beds there, or 100 rooms. We do not have the final calculations yet. I don't expect it to be cheap once the number comes in. I would think it would be, well, I don't want to say what the number is. I just don't think it's going to be cheap. Thankfully, the facility is in good condition from the roof. We were actually very happy to find out that the roof was in excellent condition. The rooms are actually pretty good. It's a matter of HVAC and electrical and ensuring the water supply is adequate for every room. Pipes have not been turned on there in a long time, so what happens when you turn on the pipes? You might have water damage. So that's all being calculated now. Madison Carter from Channel 7, are you still there?
Yeah, I don't know if you can answer these. I have a couple questions from another reporter, but we're trying to run some Q&As from our viewers, and viewers were wondering about whether takeout is still safe and whether we need to be sanitizing products bought at the store, like grocery store.
We believe that takeout is safe. That's why the recommendation is made, as long as the food service entities are following their proper guidelines and rules with regards to cleanliness. Our sanitarians still have the ability to go out, so if there was a concern with regards to a particular restaurant, even if it's just takeout now, our sanitarians can go in there, and they still have the power and are doing that. We're still sending sanitarians out to do spot checks. So we believe that food is safe. If it isn't safe and we find out about it, we're shutting the place down. And then the second portion, there was another.
Talking about people coming back from stores, we need to be wiping down those products, boxes at the grocery store and things like that.
It's up to the people if they decide they could do that. You certainly could. There's a question as to how long the virus lasts. We're asking everyone to wash their hands, use hand sanitizer. We know that we're asked grocers and stores to do that. You could do the same yourself. There's nothing that would harm the product, unless, of course, it's maybe a fresh food. You wouldn't necessarily want to put hand sanitizer on it, but I think you could wash it. That would not be a problem. And for the other things, there's stringent guidelines with regards to meat products and things like that, with regards to cleanliness to begin with, and we believe all those products are safe. I am thanking everyone. We have to go. I'm a little late for another meeting, but we wanted to get this information out to the public. I thank our members of the media for participating. I thank Jessica Pirro for the work that her organization is doing. Crisis Services is a tremendous partner with Erie County for the helpline that exists, as well as the suicide prevention line, and of course the Erie County Opiate 24-hour addiction line is run through Crisis Services, so I thank Jessica and her team for the great work that they do. And once again, I thank the public for the work that you're doing, even if it means just staying at home with the kids. I know it's not easy. You can get a lot of cabin fever in times like this, but working together, we will get through this as a community. We can't change the past. I'm very disappointed about some of the actions that were taken in the past by the federal government and the lack of preparation. But we can't change that. All we can do is what we do today and going forward. And going forward, I know as a community, we will weather this storm together. And at the end of it, we will be a stronger community for that. Thank you, everyone, and have a good day.